This is not a one-person show by any measure, and our staff, as you know, are amazing. And one of them is about to step up here. Her name is Darla Clayton. She is, I don't know, like everything having to do with patients, care, information. I know she has a title and I made it up, but I don't remember what it is. Community engagement, whatever person. But Darla is also a clinical psychologist by training, and is going to talk with us a little bit about coping and cognitive rehab. So please enjoy her.
I'm standing here. I'm really glad to see all your grown-up faces. And I've missed you. I know a lot of you, and a lot of you, I did your posters, and I got to meet you that way, but I haven't gotten to say hi yet. So hi, if you want to track me down at lunch or something, I'll be around. And we're going to talk about cognitive rehab. I forget how short I am. So I put together a little presentation, but if you guys have questions or comments, feel free to jump in and interrupt. And also, if you guys have things that you want to add because it really helped you, I think that's super important because we all know what we've been through and how it helps each other, right? All right. So, cognitive rehab, it's a therapeutic approach designed to help people with cognitive impairments improve their cognitive skills and abilities. And it's used for individuals who've experienced brain injuries like strokes and neurodegenerative diseases and other conditions that affect their functioning cognitively. So it usually starts with an assessment, then moves into teaching some cognitive exercises and compensation strategies. And then there's some things that you can do to modify your environment and metacognitive training, which we're going to talk a little bit more about. And usually it does take a multidisciplinary approach. The goals are typically enhancing cognitive skills and abilities, improving functional independence, and then just enhancing your quality of life, right? Which I think is what we're all going to therapy to do for the most part. So I just wanted to talk about some of the domains that cognitive rehab looks at. So attention and concentration are big ones, and I know a lot of folks in our community really struggle with those. And also, along the same lines, executive functioning deficits, which can kind of overlap and also have some separate things in there. And then memory impairments, both short and long term, which I know a lot of our folks have a hard time with, myself included. And language and communication difficulties also fall under cognitive rehab stuff. So, step one is usually this evaluation, which is a neuropsych type evaluation. Have people here had neuropsychs? Yeah, okay. So a neuropsych, usually you're with the psychologist for about half a day, and they're going to ask you a whole bunch of questions, and they're going to use standardized tests. And then they can use those tests to compare against a norm and see where you fall compared against someone who doesn't have a brain injury. And it can really help them figure out where your strengths and weaknesses lie, and then figure out what you need to work on to improve those skills, or really sometimes those skills are not going to get very much better, but there's strategies you can put into place to help you compensate for them. And then you set goals based on how that neuropsych assessment goes. All right, so they're going to teach cognitive exercises and training. And I think we already went over most of this already. And then that metacognitive training, I said we'd talk a little bit more about that. That is essentially thinking about your own thinking and starting to kind of double back on your own thinking, and recognizing where those problems lie. And it's not easy to realize where you are struggling. So kind of helping you figure out where your weaknesses are and actually noticing them so that you can do something about them. All right, and then it is typically a multidisciplinary approach. So oftentimes it's a psychologist or neuropsychologist kind of overseeing things, but they work with your neurologist, with your neurosurgeon, with occupational therapists, speech therapists, and so oftentimes it is a team working on this together, which is usually a pretty helpful approach. All right, so these are some things that we can do for attention and executive dysfunction type problems. One of the things they recommend a lot is breaking tasks into smaller steps or chunking. So if you think about, I'm going to make banana bread, for instance, it can be overwhelming to think about all of the things you have to do to make banana bread. But you can think about, well, the first thing I need to do is look at the recipe, and then I need to gather the items from the recipe, and then I need to do the dry ingredients, and then the wet ingredients, and then I'm going to bake it in the oven, all of the different things. If you chunk each one into a separate step, it doesn't feel as overwhelming. And you can also often take a break, right? So if you're feeling like you have a lot of cognitive fatigue, you can put the dry ingredients into a bowl and then set it aside, take a break, come back and do the wet ingredients, take a break if you need to. Visual cues or reminders can be really helpful, and I'm sort of notorious for putting notes all over my house. And I like to say that I live in my house, and I don't really care if you come in my house and see my weird notes, because they're important to me and they help me remember the things I need to remember, and they help my kids remember the things they have to remember. So, and you'll also hear my Alexa a lot in support groups. My Alexa will just start reminding me to do things, and everyone's like, what is that? Mindfulness and meditation can be really helpful for people with ADHD and executive dysfunction. Visual organizers and checklists can be really helpful. And then developing problem-solving strategies with someone who's familiar with cognitive rehab can be really helpful. All right, so then in terms of memory impairments, you can use memory aids like calendars and to-do lists and smartphone apps. Who uses smartphone apps to help them do all the things they need to do? Yeah, there's a ton of good ones. And we talk about it on the Facebook group, and a lot of times in our support groups, we'll talk about like, oh my gosh, I found this really great app, and it's fantastic for helping me remember to drink water. Like silly things. Plant Nanny. Plant Nanny is a great one for helping you remember to drink water. Creating routines can be really, really difficult. And so there's some good strategies to help you create routines. One of them that seems to be the most helpful is taking one routine and matching it with another so that you're overlaying them. And then so if you have a routine that you do consistently, then you link it to another routine that you want to start doing. So I always brush my teeth in the morning, and I'm going to link drinking a glass of water with that routine. And then once I've got my glass of water down, then I'm going to link whatever, taking my vitamin or whatever. So you just keep linking them until you get like a nice little stream of routines that you do every morning. And then again, chunking information and repetition. Repetition is so important, and I know it sounds annoying, but it does help. And some environmental modifications that we can do, simplifying things, reducing distractions, keeping things more organized, which is like an oxymoron for people with executive dysfunction because organization is already really hard for a lot of us. Labeling things, color-coded systems, and sometimes you can ask folks in your circle that don't have the challenges that you have to come in and help you put systems in place. And a lot of people are really good at organizing, and they love it, and it's like their special thing, and they'll happily come and organize your house for you because they like to make color-coded things. Assistive technology can be really, really important. There are people that specialize in assistive technology, and they can do an evaluation to figure out what kinds of things might be helpful for you in your day-to-day life, and also to make your life at work a little bit easier. If you're still at a job somewhere, it can be really helpful to do an assistive technology evaluation. Things like smartphones and Alexa and Google Home, they have great things that you can take advantage of in them if you know how to do it and know what to do. So do that. Take advantage of them. They're there. You probably already have it in your house, in your hand. So, figure out how to make it work for you and use those strategies. And then I'm a big proponent of stress management techniques. So relaxation exercises. Do we have anybody here who meditates? We have meditators. Love it. There are tons of free meditation exercises on YouTube. My suggestion is to put on a couple and listen to them. I can't stand some people's voices. So I will put it on and be like, oh, no, I don't like this one. This person's voice is making me crazy. So put it on, listen, and then try a couple until you find somebody that you jive with. There's a couple done by a group called the Honest Guys, and their voices are pretty soothing to my mind. So you can check that out. Grounding exercises, we just talked about this with the kids, but grounding exercises help you come back into the here and now, right in this moment, so you're not, kind of spinning out in your own head. So things like recognizing, things that you can hear in the environment, like that buzzing noise behind me. I didn't recognize it until I started to think about what I could hear. Or one of the techniques we talked to the kids about was thinking about a letter and then trying to find things in the room that start with that letter. Because it just makes you come into this room with your head space, right, and really focus on what's happening right in front of me. We talk a lot about self-care. It is important. It really is. Take care of yourself, getting enough sleep, using those skills to take care of yourself. Exercising as your doctor recommends, and just eating a balanced diet, trying to eat foods that are real, actual foods and not chemical concoctions. And I was mentioning earlier your support systems. Hopefully everybody has some folks that can be helpful to them. Asking for help from your family and friends, and professional help from therapists, either a cognitive specialist or just someone to talk to, a therapist that you can go just talk about your frustrations. I know for a lot of folks with brain challenges, it's hard to talk to your family about it because they don't get it all the time. So talking to a therapist is a perfectly good and reasonable thing to do, and it can be really helpful. So just like other skills, you have to practice these skills. So when you're doing cognitive rehab, or when you're learning to relax, or when you're learning meditation skills, they all take practice. So I just want to encourage you, if you do decide to try some of this stuff, to give yourself grace, not get really frustrated if it doesn't go exactly how you expect it to. If you try to meditate and you can only focus for 1 minute of the 10-minute meditation, that's okay. The next time you try to focus for 1 minute and 10 seconds. That's how you get better, right? Just like anything else, the first time you rode a bike, you didn't get on it and ride away. So same thing, just give yourself grace, be compassionate with yourself, do the best you can, and keep trying, because it will get better as you try, as you practice. All right, I think that's all I had to say about cognitive rehab. Do you guys have questions or thoughts or things that you have worked for you? I think we have like 7 minutes.
First of all, that was a great presentation. I think it just grounded me personally and brought us back into this room, live for the now and appreciate what you have around you. My question is, the cognitive rehab, do you happen to know if that falls under medical expenses or rehab expenses?
Ooh, good question. On our insurance, it falls under medical. I suspect that it varies from insurance to insurance. Does anybody else? I suspect it varies, but for us, it falls under medical. Okay. And thank you.
Hi, I just have a question. In regards to the neuropsychological testing, Nessa had hers done during her first bleed. I'm just curious, is that something that should be repeated after every bleed? I mean, how often should it be done? Because that was literally 9 years ago.
Good question. When my kids were small, we did it every year to 2 years because it mattered a lot when they were in school to know what they needed to be working on as they're kind of going up. As an adult, I would say if things are changing, it makes sense to have an updated neuropsych because it helps you know what your strengths and weaknesses are, right? So I would say every 5 to 10 years. And if there's a big change, it might make sense to have a more recent one. Hey.
So I've heard a lot of terms over the last year, cognitive behavioral therapist, cognitive rehab. Who is involved in this? Is there anybody else that should be seen besides a neuropsychologist, OT, or ST? And what is a cognitive behavioral therapist?
Okay, so cognitive behavioral therapy is a type of therapy. It's also called CBT, and it's really just connecting your thoughts with your behaviors and understanding how those things are linked. So most therapists do some CBT in some way or another.
Okay.
When you're looking for a therapist, you can ask, do you do CBT? And I would say probably 80% do, at least a little bit. And then, is there anybody else? We used a PT for some eye therapy stuff. That was I didn't expect that to be a PT, but they do. A lot of PTs do head injury, like after you've had a concussion kind of therapy, so they can be helpful, and they can also be helpful with vestibular stuff.
Okay.
Yes, a neuropsychologist will have a fellowship in neuropsychology. So a psychologist has one less year of training, essentially. They have a year where they focus specifically, or 2 years, on neuropsych stuff. So seeing a neuropsychologist versus seeing a standard psychologist is it really in our best interest when we want to know how our brains are functioning, because they definitely know more than a standard psychologist for the most part.
And how do you feel about family counseling? I mean, so that the entire family unit can understand what you're going through, because each person is going to be different, and our perception of what each person is going through is different than what is really going on.
I think it can be helpful. I'm not sure it's always possible for people who aren't experiencing to truly understand, but it might help them understand a little more.
Perfect segue, yes. This is more of a comment, but the anxiety and PTSD that I had after my bleed was probably the hardest thing for my recovery. And finding the Alliance to Cure website for information and the weekly support groups were probably had the biggest impact on my recovery. And I cannot thank you enough for all that you've done and that you offer that, and has made such a huge impact in my recovery.
I'm glad.
Thank you.
Thanks, David. I think Hannah has a question up here, too.
So I just wanted to share a couple of things that have worked for me. Being that I just had surgery 2 months ago, one of the things that really surprised me was the overstimulation that I felt immediately after surgery and for at least a month afterward. So one of the things I used was loop earplugs. If you haven't heard of them, they're really good. Basically, they drown out extraneous noise you can still hear and have a conversation, but all that extra buzzing and craziness that's going on right now, it blocks it out. So that was really helpful. Another thing we discovered is that Prime Video has white noise blackout videos. So if you go onto Prime Video and search for black screen for sleep, it's white noise, but the screen stays black. So if you don't have a white noise machine, it's free with your Prime Video subscription.
Nice.
We also use a lot family calendars in Apple in our phones. So that's been really helpful to keep track of appointments, because at first I could not keep track of when appointments were or even make appointments. So we had a shared calendar that he would put appointments on and keep track of stuff. Also, I work in tech. I actually work for Amazon. So if you have a tech question, I might be able to help you. Just track me down. Okay?
Awesome. Thank you.
I have a problem. I tune out people when they're talking. See, it's gotten worse over the years. Should I contact my neuropsychologist for that, or can you give me some exercises?
I would get in touch with your neuropsychologist and see what they would recommend. We can talk about some exercises in a general way, but I definitely can't be anyone's therapist per se because I'm not practicing in this realm. All right, are we calling it for lunch? Oh, one more?
Yeah, I just wanted to say.
Yeah, for sure.
I know she was asking about family therapy. We saw therapists in the hospital. We have individual therapists, family therapists. We have family friends who are therapists. So we've talked to a lot of therapists. And it's interesting because I feel like for family, I mean, I know everybody's different, but some of us are less vulnerable than others. And I think that having a setting where you're talking to somebody, sometimes our less vulnerable folks in the family will be, keep looking at you, will share more, and I feel like it helps the rest of the family understand where they are, like how they're feeling. There's so much mental, the physical part, it's visible, right? So there's therapy, there's things, and it's obvious when there's a physical deficit, but I think it's so hard for family specifically to understand what's all going, you're mourning how you used to be, you getting frustrated at your inability to process executive thing, like all of that. And I think that through family therapy, or just through therapy in general, at least for me, I was able to really understand her experience and I guess be more patient and supportive.
Excellent. Thanks for sharing.
I just want to add to that. For all of us, we should realize how strong people we are. And yes, it's a rare disease, blah, 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 but we are very strong people, and I hope that our families can realize that as we speak to each other and share our thoughts, they realize how strong you are. So I just want you to realize how special and strong you are.
I just wanted to share that on Monday, I'm starting a class called Mindfulness-Based Stress Reduction, which I think kind of fits into this. And yeah, so it's been 20 years since my first brain hemorrhage, and I should have done this a long time ago. But my insurance is going to cover at least part of it. I've argued with them and argued. What happened was I got a diagnosis code, and then I'm going to have to get a procedure code. But my doctors are very helpful, and they're going to give me something that's going to allow my insurance to cover part of it, and then the rest of it is going to come off out of my flexible spending. So if that's helpful to anybody,
Nice.
to get you some coverage for something like this, because it's not too cheap, and then it's going to cover things like stress, depression, anger, PTSD. I don't have suicidal thinking, but things like that. And then it's going to teach you meditation, which I have tried and failed at, yoga, gentle stretching, relaxation methods, because I have trouble sleeping. My mind spins and spins. Body scanning. I just thought I'd share. This is at Duke Hospital. For anybody who lives in North Carolina, but I'm sure you can find this at some other center of excellence as well. So just thought I'd share.
That is a great suggestion. And just yoga in general, they do a lot of this stuff in yoga classes. So if you have a yoga class near you, you can hop into. They do a lot of meditation and things like that.